Hi there. Hello, Mr. Mayorov.
Hello.
People with diabetes lead a full, active life, and they like to travel, of course. Are there any nuances that will help them control their blood sugar levels far from home?
Of course, you should not abandon traveling only because you have diabetes. But you should prepare for the trip beforehand and follow a number of certain rules. First, always carry an ID card with you. Sometimes it's called the diabetes passport or certificate, and you can make it by yourself. What should be included in the passport? First, your name, then the contact information of your relatives, to be addressed in emergency cases, the contact information of your doctor, and the names of medications. And most importantly, for you, as a diabetes patient, the names of insulins you are currently on. Second, in addition to the diabetes passport, make sure to always carry a medical certificate issued by your doctor in charge. You may need it, for example, when crossing a border and at airport security checkpoints when you carry insulin. In this certificate, it should also be specified that you have type 1 diabetes, that you are in the insulin therapy, that you take certain insulins, and their names should be included, and you may need insulin shots for your flight. Third, don't forget to take your glucometer. Sometimes, when the trip is going to be long, you should take 2 glucometers in case one of them fails. Also, you should have an extra battery and a sufficient amount of test strips and lancets for piercing the skin. Fourth, never put your insulin and devices of the glucose level self-control, that is your glucometer and test strips, in the checked bags, because insulin may be damaged or lost, or it may be frozen, so it should be stowed in your cabin luggage. The next rule: you don't put your insulin in the checked luggage, but if your travel destination is a country with a hot climate, then insulin may be overheated. That is why it is recommended to take a thermal bag with you, which will allow you to preserve insulin at a recommended temperature. During a trip, you must, and you should do it not only during the trip, you must have a sufficient amount of food rich in simple carbs. In this case, your supply of this food should be even greater because trips are associated with a physical load and the probability of hyperglycemia is high. Therefore, you must have either glucose tablets or several lumps of sugar or carton fruit juice or what you use. Besides, you should obtain a medical insurance policy beforehand. An accident may happen to any person, not just to people with diabetes. There may be an injury unrelated to diabetes. So please buy the insurance policy and have it with you. There is one more recommendation. As with all other travelers, people with diabetes should take regular medications which you may use if you catch colds, in case of diarrhea and vomiting. And it is important that patients with diabetes take agents to treat wounds or callosity that may develop during the trip. You may take bactericidal adhesive bandages or other medications used by people with diabetes in these cases. And there is also a very important problem that's worth mentioning. Traveling is not your regular routine, so your need in insulin may change in either direction during this period of time. The need may drop if you have intensive physical activities, or it may soar. Why? Comorbidities, any concomitant disease may increase your need in insulin. Or there may be food that's new to you, very nice looking and interesting food you may want to try. You will eat more, and it's not forbidden, but you should take correct insulin doses. So, to avoid situations when you lack insulin, there is a general standard recommendation. You must take a double supply of insulin compared to that you would normally use over this period of time in your habitual environment. Double supply of insulin and correspondingly pen needles, lancets, test strips, and so on. This is a general rule.
Thank you, Mr. Mayor, for such a detailed answer. Now I know all nuances to be taken into account while planning a trip.